Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 8 new cases of COVID-19 in Windsor and Essex County. 4 are close contacts of confirmed cases, 1 is community-acquired, 1 case is travel-related outside of North America, and 2 cases are still being investigated. We have had 16,729 cases since the beginning of the pandemic. 109 people are active at this time, with 50 of our active cases being a variant of concern. To date, 1,918 preliminary or confirmed variants have been identified in Windsor-Essex County. 14 people are currently in the hospital and 3 people are in ICU. Our community has lost 433 people to COVID. There are currently 5 active outbreaks in Windsor-Essex County, 3 workplaces, and 2 community outbreaks. Now for our vaccine update. 343,182 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 265,233 people have received at least 1 dose. Overall, 72.5% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. 22.4% of our adults 18 years of age and older are fully vaccinated with 2 doses. Residents of Windsor-Essex, 12 years of age and older, are able to book their vaccine appointments for a first dose at one of our mass vaccination sites. Seniors, 70 years of age and older, are able to book their second dose appointment. In addition, those who received their first dose of vaccine up until and including April 18th are able to book their second dose at one of our mass vaccination sites. There are new changes to the AstraZeneca interval. People booking an appointment on our booking system will be able to book their second dose 8 weeks from their first dose. We have updated our website, so please read the information posted on our website about this change. For those who would like to receive a second dose of AstraZeneca, please contact your pharmacy or healthcare provider where you received your first dose. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Today I want to talk about the reduced interval of AstraZeneca and the interchangeability of the COVID vaccine. As Teresa mentioned, that there's further announcement on reducing the dose interval for AstraZeneca people who have received AstraZeneca at least 8 weeks ago. They can get their second dose of AstraZeneca, or they can choose to receive a second dose of their mRNA vaccine. We talked about these interchangeability of these vaccines, that how these vaccines work and whether it is safe and appropriate for us to interchange these vaccines to get the desired immune response that we are looking for. Vaccine interchangeability is not a new concept, and it happens all the time, and most of the time we don't even know or we don't even pay attention to what these vaccines are or what brands of these vaccines are. The only recommendation that we always obviously have is to try and stick to the same mechanism of action. We know COVID vaccines are new, and there's a lot of interest in terms of understanding the different types of vaccine, understanding how these vaccines are effective, and if there's any difference in how these vaccines are work in our bodies. COVID vaccine, such as Pfizer and Pfizer and Moderna, they both use the mRNA-based proteins that triggers the body to create a spike protein. A spike protein is the identification of the SARS-CoV-2 virus. On every SARS-CoV-2 virus, there is an identification protein or antigen, what we call them. The body identifies those spike protein as a potential invader, and then they try to create a response against that spike protein. Both Pfizer and Moderna identify those spike protein, or helps the body to create that spike protein that the body then identifies and develop an immune response to that spike protein. And by the second dose, the body's immune response is up to that point that any new spike protein containing virus, which are the coronavirus, if it enters the body, it protects the body from getting severe complications, and it protects the body to fight off that virus without this virus causing any disease. So it is important that we understand that how these vaccines work. Both the vaccines, whether we are talking about Pfizer or Moderna, they use the same method. When we're talking about the AstraZeneca is a viral vector protein, which is basically a component of the viral virus is introduced into the body through the use of the vaccine, and then the immune response is generated. So two different mechanisms, but based on these studies, they've already found out that if people who have received AstraZeneca, they are okay to receive a second dose of AstraZeneca. The risk of WIT, which was the main concern for switching the recommendation, is they are given an option to receive their second doses of the same vaccine or to switch to an mRNA vaccine. Most individuals in our community have opted to go with the second dose of the AstraZeneca vaccine to complete their series using the same vaccine, but they do have the option to switch to an mRNA vaccine. The switch between mRNA to an mRNA vaccine, it's something that we are all looking at, and we have the NACI statement to guide us, which basically says that the National Advisory Committee on Immunization recommends that if readily available, the same mRNA vaccine product should be offered for the second dose in a vaccine series that started with an mRNA COVID-19 vaccine. However, when the same mRNA vaccine product is not readily available or is unknown, another mRNA vaccine product recommended for use in that age group can be considered interchangeable. It should be offered to complete the vaccine series. The previous dose will still be counted, and the series will not be restarted, but in fact, the series will be completed. And this is one of the strong recommendations for NACI. So basically, NACI is strongly recommending that there is no concerns about these vaccines interchangeability, the mRNA, whether we're talking about Pfizer or Moderna, and their mode of action, their side effect profiles, and everything else is exactly the same. So there is no difference. And we have always said that. I have always said that here, that people should get the first vaccine that is available to them instead of waiting for any other vaccine. So it is important that we get that immunity, we build that immune response into our body before we continue to move on with the rest of the activities. What we also know is Ontario is getting more than 2 million doses of Moderna vaccine before the end of the June. So that means basically in the next 2 to 3 weeks, Ontario is getting more than 2 million doses, which would mean that we will have plenty of vaccine for Moderna in our region. And we know the main vaccine that we have distributed in the past is Pfizer. So we will be in a position to offer early or shortened interval for the mRNA vaccine. And as I mentioned, in terms of the mode of action, in terms of the safety profile, in terms of the effectiveness of these vaccines, they're both basically the same vaccine. So I would be strongly encouraging people that when offered one vaccine or the other, it is safe, it is effective, and it doesn't change anything other than making sure that your body is generating the immune response that it needs to get the desired protection. It will allow us to vaccinate our people with 2 doses in a short period of time, knowing that we will be getting lots of vaccine in the coming weeks. So I would strongly encourage everyone, if they're given the option to receive Pfizer or Moderna or interchangeable, if they're interchanged based on the availability and the supply, please do not hesitate to get the second dose of the same mRNA vaccine. I'll stop here and we'll take questions. Thank you.
We'll now take questions from the media. Today we'll start with CFTV.
Yes, good morning. If it comes down to a booster that you have to get once you've had the initial 2 shots, is it going to matter at that point which booster you get?
So at this time, there is no formal recommendation on the booster or whether we would need the booster, what would be the timing of it, and whatnot. But the same concept, it's about the interchangeability of these vaccines. So let's say, for argument's sake, if we end up in making a recommendation, or if NACI or other regulatory authorities If they recommend that a booster dose is necessary, the same concept would apply, and it would be the same as getting an extra dose of any mRNA vaccine that's available and that's currently approved in Canada.
Okay, thank you very much.
Any questions from CBC?
Yeah, so for people who got the AstraZeneca vaccine, should they try to stick with that if possible, or if they're comfortable with it, or should they get an mRNA vaccine potentially quicker?
Well, as I said, get the first vaccine that's available, and the preferential recommendation obviously is especially for AstraZeneca, and we have mentioned, so based on the different mode of action, it may be it is slightly different, and we also know that people who have received a second dose of an mRNA vaccine after receiving their first dose of AstraZeneca, they may have a little bit more pronounced reaction, which is, again, not the serious side effects we're talking about. We're talking about the usual side effects, such as the pain, fever, and that may be more pronounced with the mRNA vaccine after receiving your AstraZeneca vaccine. But in practice, it doesn't matter, and it hasn't been a case that that should prevent people from not getting the mRNA vaccine. So same recommendation, advice, so people can do their own risk assessment in terms of whether they want to stick to the second dose of AstraZeneca. I know, and I can tell if Teresa doesn't mind, that she opted to choose her second dose of AstraZeneca vaccine. So she got first AstraZeneca and second dose AstraZeneca as well. And many people that I know that they have done exactly the same, first and second dose of AstraZeneca. But it's basically, it's a choice. I wouldn't say that there's any preferential recommendation one way or the other. It's a choice based on your risk assessment, and the same idea based on the availability of the vaccine as well. So let's say if I don't have any AstraZeneca vaccine, I would be saying that people get your second dose of mRNA vaccine instead of waiting for the AstraZeneca vaccine, or vice versa. So that if we don't have enough of the mRNA vaccine, but we have plenty of AstraZeneca vaccine, I would be saying that, hey, get your second dose of AstraZeneca vaccine. So it's just based on the supply and availability. At this time, get your vaccine as quickly as possible so we as a community can move forward very quickly.
So for the changing of the interval down from 12 weeks to 8, previously we were told that the best interval was 12 weeks. People should still be getting the vaccine as soon as possible?
Well, we have, so great question, Carrie. I think for AstraZeneca, the evidence is still there that 12 weeks is the right interval. Knowing that there has been some concerns with the Delta variant, and especially in areas that are seeing some of these Delta variant, and the push to get more people vaccinated. There is some recommendation even from the provincial science table that's recommending a shortened interval because of the risk of Delta variant. I still think that 12 weeks interval is the appropriate interval, but that option is there. It doesn't mean that everyone should take that option. And even when we are talking about the other interval, there has to be some kind of a minimum interval regardless, because that helps the body to generate a better immune response. So 8 weeks should be the minimum one, even for AstraZeneca, in my opinion, but preferentially in terms of the interval for the AstraZeneca, I would say 12 weeks is still provides the better immune response, but the option is there for these people.
Thanks very much.
Any questions from Blackburn?
Yes, good morning. I was on the booking site today, and when you go on to the Nature Fresh Center, it says there are no times available, and there's not even like the dates listed there like on the other sites. Are you still using the Nature Fresh Farm site?
Yes, I'll respond to that question. We're actually starting our second doses for the farm workers this week and into next week. And so the general public will be able to book at Nature Fresh on Saturday.
Okay. I think that's it for now. Thanks.
Any questions from from the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. Is the reduced interval for AstraZeneca only for those seeking a second dose of AstraZeneca, not for those seeking a second dose of mRNA?
So it is for both. And again, it depends on the supply of the vaccine. So if someone is looking to get their second dose of an mRNA vaccine, they'll have to go through the booking system and based on the availability of the appointments. But technically, yeah, they will be eligible. So if there is any opportunity and if they want to get a second dose sooner than later, they can get that. And again, just to say that point in terms of the expedited interval for some of these vaccine regarding the Delta variant is an important one. And with 2 doses completed, the protection is higher for Delta variant. And with single dose, the protection may not be as high as we'd like it to be. Knowing that some of these recommendations are provincial recommendation and it comes from the province, and we already know that GTA is already seeing a surge of Delta variant. So when these recommendations come in, it comes in for the entire province, and it's also available for us. So we use that, but that doesn't necessarily mean that the risk level is the same for them versus us.
Okay, keeping that in mind, as you said, there's better level of protection offered at the longer 12-week interval, but you get more protection, or you get protected in some way quicker if you get your second dose faster in terms of the threat posed by the Delta variant. So somebody who's confused, somebody who says, well, I want the most protection possible, but I want to be protected quickly. But what choice do they make here? Do they take the 8-week or do they wait till 12?
So a great question, Taylor. And I think what I would see is my own risk. If I see that I am working with people who are where I can potentially be exposed to someone with a Delta variant, or if I am someone who is living in my home and I'm following all the public health measures and I'm not even seeing people outside of my immediate family members. And if the risk from that perspective is low, I would say complete your 12 weeks and then get your second dose just to get better immune response in your body. But if I am someone who, let's say, who works for a restaurant or who is an essential worker, and there is risk of exposing myself to get to people with potentially carrying a Delta variant, then I think I would prefer to get the second dose earlier rather than waiting for the full 12 weeks. So there may be some differences individually, but and again, individual circumstances are different. If you're considering traveling, if you're doing any of the high risk activities with that involves more people, I would recommend that you get your second dose sooner than later. But for others, they should wait and get their second dose to have a lasting impact on their immune system by getting the second dose interval at the appropriate time.
Thank you.
Any questions from AM 800?
Teresa, were you able to talk to your team this morning about how the weekend went and how the businesses complied with the reopening for stage 1?
No, we haven't connected yet about the events over the weekend, so we'll get that information, but not quite yet.
And then going back to Maureen's question about the Nature Fresh Center and the farm workers, like you mentioned, looking back here at the story we did in May, and you said about just under 4,800 workers got their first dose. If, I guess, when that process starts, like you said, for the second dose, how long is that expected to take?
So we think we're going to be a little bit more efficient with the second doses because we can move people a little more quickly with second doses, and anticipate will probably be done a little bit ahead of time. So we are looking into this week doing the 4 days with the farms, and next week 4 days, and then hopefully we're finished. But we will also have the ability to do first doses as well. So we'll see how it goes, but I think we're on track to have them completed in the next couple weeks.
Are there still some workers, temporary foreign workers, that need their first dose if they choose to get it?
So we had a couple of pop-up clinics, not too long ago. And over the course of 2 afternoons, we did over 400 people that were temporary foreign workers. So we know that there are people out there that probably have not been immunized quite yet, and they continue to have that opportunity to get their first dose.
Is that 4,800 number still accurate, or has it increased significantly, or is it in that ballpark still?
I think it is a little bit higher just because, we've been doing doing immunization all along since then. So I would say around 5,000, but we'll have all of those numbers as we start immunizing again. But I know we're moving forward tomorrow. Tomorrow's Tuesday. We're moving forward with a couple of the farms, and they're ready and able to go. So things are moving quickly, and we do want to get our farm workers vaccinated with their second dose and be fully vaccinated for this summer.
And then one quick one just in regards to vaccine. When it comes to AstraZeneca, do we still have a good amount in Windsor-Essex?
So this week is actually a really good week for a vaccine. We're expecting almost 49,000 doses of vaccine in Windsor-Essex County regarding Moderna, Pfizer, and AstraZeneca. And so AstraZeneca, we have about 4,600 doses coming to our area. Let's see, I think it's about 17,000 doses of Moderna and 28,000 doses of Pfizer. So lots of vaccine coming to our mass sites, but quite a bit going to pharmacies, about 18,000 doses to our pharmacies and then to primary care. So this is a very good week if people are wanting to get first doses, second doses. We have quite a bit of vaccine coming to the area.
Thank you.
Any questions from CTV?
Yes, this can simply be a yes or no answer. You guys are very clear about how you feel when it comes to mixing doses. Do you still feel as strongly for women who are pregnant?
So for women who are pregnant, I think the recommendation is still there. There is no evidence at this time to have any kind of negative impact on pregnant women for receiving any of these vaccines. In fact, in some studies, it even showed that the children born to women who were vaccinated, their newborn infant had some level of protection already in their system. So there is no preferential recommendation, and they should get the vaccine as quickly as possible as per preferential recommendation from the province.
Just to clarify, because I know that they were directed at mass vaccination clinics to get the Pfizer vaccine. So should they wait and be patient for the second dose of Pfizer, or again, mixing doses is completely okay and healthy for them as well?
So thanks for clarifying your question. Yeah, no, it's the mRNA vaccine. Both these vaccines, there is no no difference. So even if you receive Pfizer, you can get Moderna as well. I think I wouldn't say that they were recommended to get Pfizer at the clinic. I think they were recommended to get an mRNA vaccine rather than getting the AstraZeneca vaccine.
Okay, thank you.
Okay, so before I move on to the second round of questions, I'd just like to make sure that through the media, I also share that information. We did send out a memo to all our long-term care home partners, retirement home partners, congregate living settings, and our health system partners about healthcare workers working on more than one location. And as per ministry direction, or Ministry of Long-Term Care, when they allowed healthcare worker to work in more than one location if they're fully vaccinated. Locally, our recommendation has been right from the beginning of the pandemic is for people or healthcare worker to restrict their work to one location only. And this was done to protect the area from one individual if they contract COVID from infecting more than one facility where we have high-risk individuals in these facilities. So in order to move forward, now that we have a good and high vaccination rate, we know that our COVID case rates are going down, and we are trying to switch to a more routine or regular protocols, if you want to call it. And based on that, starting today, people working in these healthcare settings, they will be allowed to work in more than one location if they're fully vaccinated. So I just wanted to make sure that we share that information with all of you. All the health system partners are already aware of this change, but starting today, they will be allowed to work in more than one location.
Any additional questions from CFTV?
No, thank you.
Any additional questions from CBC?
Yes, with the resumption of outdoor dining, I was wondering what exactly the rules are around wearing masks. Like, at what times should people be wearing a mask, and at what times is it okay for someone to remove their mask?
A great question. So when people are entering any kind of outdoor spaces for patio dining, they are to wear the mask until they are seated in their chairs. And all the time that they are seated, they can remove the mask for the purpose of eating. I would recommend only remove it when you're actually eating. And anytime you're leaving your space or your chair, you have to wear the mask. So by the time you enter the facility, up until the time you sit down at the chair, you have to you must wear a mask.
So would you recommend that someone wear a mask while their order is being taken?
Yes, I think that will be a recommendation. But as I said, if they're sitting on the chair, under the regulation, they may, because again, it is very difficult to enforce some of those things. But I would recommend that people should wear the mask even when they're ordering, and remove it only when they're actually eating.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
Ditto.
Okay, thank you everyone. We'll see you on Wednesday.